Good afternoon, and welcome to our TPEA conversation regarding the basics of long-term care. My name is John Green with Association Member Benefits Advisors. I'm joined today by my co-host, James Johnson. We'll be able to take your questions in just a moment. I want to talk just briefly about some housekeeping details before we get started. We do record every one of these sessions. We make them available out on the TPEA website for our members. You'll be able to go out there behind the member portal and have access to these in the future, especially for this particular webinar. When we talk about long-term care basics, it's really one that a lot of individuals like to share with their family members, especially with their spouse as well, and talk about the topic at hand. You'll also notice that all participants are in a listen-only mode. And what that means is that if you have a question, feel free to drop it into the Q&A feature. And that includes not only the legislative questions that you may pop up as well, but what we talk about here today as we go through that as well. We're joined today by Ann Bishop, the Executive Director of TPEA, Charlotte Wilson, who runs the operations there, and then Ray Amell, who is our legislative liaison. And so there's a lot of stuff going on the Capitol right now, Ray and Ann. So I imagine you're extremely busy. Tell us what's happening.
Well, thank you, John. First of all, thank all of you for your service to the state of Texas. We never want to forget to mention that all you've done that's so important to how this state functions. And for those of you who are retirees similarly, but let me talk about retirees. The appropriations bills, the budget bills, and by the way, this is the only item the legislature is required by the Constitution to pass. That is the appropriation bill. So both the Senate and House bills have provisions that fund state employees and retirees insurance, your very valuable benefit, your insurance. And that means that at the current levels of premiums and the current levels of benefits, as ERS is saying right now, this is enough. The money put into the bill would be enough to continue your benefit at the same level. Additionally, it funds the ERS retirement with monies that honor what's called the legacy payment that was put into place last time, and that's about another $1 billion. And it funds it so that the fund can get to the cusp, the very cusp of being financially sound. And there is a consideration for adding more money in another bill, what's called the supplemental appropriations bill. So additionally, for those of you who are correctional officers or law enforcement, are retired from those categories of employment, the Law Enforcement Correctional Officer Supplemental Fund is receiving a large additional payment from the state, from the legislature, in order to bring it back to fiscal soundness. And meanwhile, TPEA has continued to visit with various legislators and their staff and testify and advocate at both the budget committees of the Senate and the House, and you can access that, but you can see that we've been testifying on behalf of agencies and of course for ERS itself for its continued funding. So now what if you're an employee, an active employee, what is the, this shows you that we've had other retirees, I'm sorry, I didn't mean to skip ahead so fast. This shows that just this week, a group of retirees joined Ann and myself as we trekked across the Capitol and visited a slew of legislative offices. We saw some legislators, we saw some legislative staff, and usually it's staff because the legislators might be in session. But we wanted to get the word out, and we gave handouts to the folks that talked about the need and the necessity for an additional an increase in annuities, benefit enhancement for retirees. So that's what we were doing there, and that's some of the folks you see there in these pictures.
So tell us a little bit more about that ERS statement on the status of the retirement plan.
ERS has now made public a statement on where their fund stands and on what kind of increase that they would be giving at the very least to retirees. They're saying that they think their actuary says that they can reach a legal standard of being considered actuarially sound in basically December of 2024. That would allow them, and they expect to be able, quote, to implement a COLA for retirees in January of 2025. That would be, however, applicable only at this point to retirees at that time in January of 2025 who had been retired at least 20 years. Let me repeat that. They are anticipating and expecting to be able to pay a COLA to retirees who have been retired for at least 20 years as of January 2025, based on the funding that's in the appropriations bill right now. So that's something that is a good start for retirees. Additionally, we don't want to, now we'll move ahead to those of you who are active employees. The appropriations bills, both of them on the House and Senate side, are identical. They include a 5% pay raise for each year of the coming biennium, with a $250 or $3,000 a year minimum increase each year. That means that for those of you that are making less than $60,000 a year, you will see probably an excess of a 5% increase in your monthly salary. That will be applicable to classified state agency employees and to legislative employees. It could start, however, going again back to additional legislation that will be submitted in what's called the supplemental appropriations bill, and that should be submitted sometime in the first week of March. That would accelerate this pay raise to June of 2023. And TPEA has been testifying at budget committees on both the House side and Senate side in favor of this pay raise, as well as, and thanking the legislature for this pay raise, as well as some targeted raises for those of you in some of the specialized positions that might, in order to catch up, might need a little more. But you can track the appropriations bill and other employee and retiree related bills on the TPEA website, tpea.org, and push the advocacy and the advocacy action center buttons. So again, thank you for your service, and know that we are very active. We'll be, in fact, this coming Monday and Tuesday all day at the Capitol, testifying before the House Appropriations Committees.
Thank you, Ray. And you want to fill in a little color, what your commentary on what you're seeing there in the Capitol these days?
Yes, the committee hearings are starting for regular bills that have been introduced. In fact, next week, there's a number of committee hearings that are different than the Appropriations and Finance Committee hearings. The schedule so far is that the agencies are invited to do invited testimony to give overviews, and then the bills will start being heard shortly thereafter. Bills are being referred to the committees, so you know where the bills are and which committees are responsible for hearing those bills. If you want a list of the bills that we are tracking, to go to our website under advocacy, and under advocacy there is an advocacy page that you can click on, and one of the tabs contains the list of bills. It says bills at the top, the list of bills that we are tracking, and they include general pay raises, state employee holidays, state employee leave bills, as well as retiree bills and some general state agency or HR related bills as well. So those are on the webpage. If you go and sign up for that, you can get updates for those bills, and you'll know where we'll be when they are having their hearings.
And to be clear, in this coming weekend, neither the House or Senate committees have scheduled any of the bills that we're watching for hearings at this time. And another important date to keep in mind is that March 10th is what's called the bill filing deadline. And that's the time at which the rules do not have to be suspended in order to submit bill legislation. So that's a very important date to look at. And there'll be a whole bunch of new bills filed right at the last very deadline. So we'll keep you posted.
Great. Thank you, Ray. Thank you, Ann, for that phenomenal update. If you're joining us on this webinar today and you're not a TPEA member, I highly encourage you take your smartphone, open up your camera feature, hover over that QR code, find out more about how to join TPEA, because that small investment that you make as a retiree or as an active state employee makes a huge difference in making sure that your voice continues to be heard at the Capitol. Some of these things that are looking like they're going to go right into the budget and just roll right on out, it's been a lot of work that the TPEA staff as well as TPEA members have put in to make sure that it gets to that point. So don't let that momentum slow down. Please join TPEA, because your benefits of TPEA, one, they not only work for those pay raises, the cost of living of the 13th check, but as Ray mentioned earlier, protecting what the state pays towards your health care, whether it's for yourself or for your family members, providing you access to best-in-class optional insurance benefits, things like that, and then keeping you connected. There's many other values that TPEA provides for you. So now's the time to join if you're not a member. We'll help you get involved, help you get connected with other members of TPEA, and possibly use your voice to further the causes of state employees and state retirees. At Association Member Benefits Advisors, or AMBA, we partner with TPEA to provide membership support as well as supplemental benefits that maybe you don't have through the state. So some gaps that you may have that the state doesn't provide. They're portable if you decide to leave the state employment for whatever reason, or you retire, because there are some benefits that you leave behind that you don't take with you. But the really nice feature that TPEA members have is they can extend benefits to their children who have maybe aged out of your state benefits, or to family members that are not eligible for things such as long-term care, hearing benefits, dental vision, things like that. So today we're going to talk about long-term care, and I'll show you a little bit of why we're talking about this conversation today. We're going to discuss some of the myths and facts around it, discuss the need for it, maybe the traditional components to show you, because there are probably many of you on this call that have taken out a long-term care plan. We're going to talk about the traditional components, talk about some of the solutions and the options that you have through TPEA. But to help James and I kind of steer our conversation today, I want to launch a quick poll. And if you could tell us on this poll a little bit about what you've done to prepare. So if you can tell us, do you have a long-term care plan of some sort? Yes or no, or if you're not sure, that's okay. So we'll get in some participation rolling here at the lunch hour. We appreciate you joining us, and this will help us with our conversations we go through. And always, as a reminder, if you have questions, drop those into Q&A, and if it's something that we can answer to you specifically, we'll respond back that way. If it's something that the group can benefit from wholly, we'll pause the conversation and talk about that as well. So we'll take just a few more seconds to keep the poll open, and we've got a real good response rate going on here. So I'll close it out in 3, 2, 1, and end this poll and share the results here. So we've got a really interesting group here. We've got about 30% of you, I applaud, who have taken the steps necessary to prepare for your future with a long-term care plan. The other 2/3 of you haven't, and then a couple of you are not sure, and that's okay. The reason we have these webinars through TPEA is it's educational in nature, to make sure that you've got peace of mind knowing I have what I think I need. I don't know if I have what I need, or, I'm not sure, I'm somewhere in between. So we're going to walk through a lot of conversations today, but part of the reason we do this, your ERS benefits have been worked hard for and earned by you, by TPEA. Many people don't realize that TPEA was there before some of the benefits the state even offered, and we're strong advocates of adding these benefits. You have great benefits through the state, great state contributions towards your rates. One thing that the state no longer offers is long-term care. They used to offer a group type plan where you could come in and you could qualify and receive an individual policy at a group type rate. They no longer offer that anymore. Many companies don't offer this anymore. We'll talk about this a little bit more in our 201 section. You'll also notice a separate QR code throughout our presentation today. If there are some specific things that you would like to ask about or find out more information about your TPEA benefits, you can use that QR code, and we'll have that at the end as well. So you see I circled this on your ERS website. Please familiarize yourself with your ERS benefits. Go out to the website, look around, but they talk about long-term care is no longer offered. So if you have one of those plans, we're going to touch on it briefly today, but we'll talk about more about it when we talk about in 201 as we go forward. So this is a reason why I'm so passionate about this particular subject. This is my father and I on July of 2020 at a memory care facility there in Austin. He had just been moved there about 2 months before from a facility in Marble Falls. And this was the last time that my father remembered who I was. He was an all-state athlete in 3 sports, ran track at the University of Oklahoma, played competitive basketball well into his 60s. He is the son of a state employee. My grandfather retired from the Texas Highway Department. And I never thought that my father would have health issues. In his early 60s, he had a series of small strokes that led to vascular dementia. And he passed away in October of 2020 from that vascular dementia. But because he took out and had a long-term care plan, it allowed my family, my stepmother, my brother, and I to maintain standard of living and to provide for all the needs without any concern of how he was going to be taken care of. So I'm going to try to color a little bit of our conversation today based on my experiences that he had and how it impacted the family, because really long-term care impacted my father, that we were comfortable in how he was taken care of, but more importantly, it impacted who he cared about the most, his family. And so we'll color that conversation as we go through here and talk about how long-term care works. But I do want to do a quick pop quiz. So if you'll grab a piece of paper, number it 1 through 6, and answer true or false to these questions. That long-term disability and long-term care are the same thing, true or false? Very few people ever need some form of extended care, true or false? And really, once you reach over 50, that's really the only people who need long-term care. That nursing home and confinement is the only type of long-term care option there is, true or false? And that Medicare or Health Select, they're going to pay for everything, true or false? And I should just go ahead and wait till I retire, or I should just wait till I'm over 75 to even consider anything long-term care related. So if you answered anything other than false to each one of these, that is incorrect. Each of these is false, and we're going to explore these as we go through here. The first one, oftentimes, especially active employees with the state, confuse their long-term disability with long-term care as the same thing. Your long-term disability is a very important component of your benefit plan that the state provides for you. That ensures your paycheck. And depending upon the way it's structured, how long it runs and things of that nature, but that is something that is different than long-term care. Your long-term disability ensures your paycheck. Long-term care coverage will help ensure how you live and how you're taken care of. So there are 2 different things in there, and then we'll address these others as we go through here as well. So thank you for taking that quiz. The federal government provides us with information about long-term care. And what they tell us is that over 70% of us, once we reach the age of 65, are going to need some form of extended care in our lifetime. Now, it may be like my father, who needed it for the last 2.5 years of his life related to his dementia, or it could be related to an accident or a fall or something like that, just for a 3 to 6 month period of time before you recover and get back on your feet again. But we're going to need it. Overwhelmingly, the numbers support that. So I want to take a look at what a long-term care plan looks like. And for those, the third of you who are on the call who have a long-term care plan, this is really designed to help familiarize yourself with the components of what a good long-term care policy looks like so that you'll understand it better. And you can be able to pull up your policy and say, do I have these components? Do I need to review it? Something like that. And I want to illustrate this in terms of a good hamburger, because when you build a good hamburger, you can customize it the way you want to. With the state offerings in the past, you had a little bit of customization. If you bought this from an outside insurance agency or an insurance broker, you probably had more opportunities for customization. So let's go ahead and explore what qualifies a long-term care policy to be paid. And the first qualification to trigger a long-term care policy or go on claim is the loss of an activity of daily living. And so most policies will define that you need to lose 2 or 3 daily activities of daily living. These are bathing, toileting, continence, the ability to transfer yourself or dress yourself, or feed yourself. If you lose 2 or 3 of those, the insurance policy provider says you can now go on claim and start to receive benefits. Some companies say your doctor has to certify this. Others, they'll send an independent review to do it. So it varies depending on company. That's one of the ways that you qualify for your benefit. On the other side is you could have a cognitive impairment such as dementia or Alzheimer's. And this is the case of my father. He, in his early stages of his dementia, he could do all of his activities of daily living. He could take care of himself, but at night he would get up and he would wander off. He was a risk to himself to fall or something of that nature. So the cognitive impairment like Alzheimer's or dementia can also trigger a benefit. And then the meat of your policy is your daily benefit or a pool of money. And some of the state plans that I've seen from the past that they no longer offer were a pool of money. But basically it says you either receive a set dollar amount per day or you have a total amount of money that you can use for your care if you need it and you qualify for long-term care. Now, then it will couch it in this concept of a length of coverage. So say you have $200 a day worth of benefit. You could have that length of coverage for 3 years, for 5 years, or maybe lifetime as long as you're alive. And that policy would pay out that amount of money every day for as long as that policy coverage was in effect. Or in the case of pool of money, like I said, many state employees have this type of plan. A pool of money says you have $100,000, $300,000, or some different amount that would be provided for your care. And as long as that money lasted, then you received paid for care. After that, it was your responsibility to pay for it yourself. So that's really the 2 different ways that the meat of a long-term care policy pays for it: daily benefit amount or a pool of money. Then you have what's called an elimination period. And this works very similar to a deductible on your homeowner's insurance, where you're responsible for the first 1% or 2% of a damaged claim on your house before the insurance company pays. The elimination period works the same way in a long-term care policy, where it says you're responsible to pay for your care for the first 30 days, the first 60 or 90. Some policies are even the first 180 days. So it could be a longer period of time. Most state plans that I've seen have a 90-day elimination period, which means that you're on the responsibility for 3 months of your care before this policy kicks into place. So that elimination period is very important because that could be a lot of money out of your pocket, but we'll talk about some solutions for that as well. Then as you're building a good hamburger, just like the same way you would build a good long-term care policy, you have different options or riders on top of that. Some allow you to choose location of coverage. Some plans say you just have care in a nursing home. Other plans allow you to have care at home. So again, some will say you can have 100% coverage in a nursing home, or you can have 70% of your daily amount to be cared for at home. Why it pays to have a policy review every so often to make sure you know exactly where your coverage is and what that coverage will provide for you. Then you can look at things such as non-skilled services. Some plans provide for a non-licensed or a skilled nurse to come to your house to provide light housekeeping services, cooking, cleaning, things like that, or even just helping you transfer out of a chair, or in the case of my father, to provide for someone to come over to his house and stay up with him at night while my stepmother slept because she went to work the next day, so that he wasn't a flight risk, that he wouldn't get up and hurt himself. So some plans provide that, which is a really, really nice coverage. And then finally, inflation protection. It's been many, many years since the state offered a long-term care plan. Inflation protection is a very valuable component on long-term care plans. And I'll show you in a moment what the costs are in the state of Texas, because inflation protection will give you the opportunity to increase your coverage by a small amount every year, every couple of years. Most companies offer this as an optional rider, and they'll say, we're going to insure you for X number of dollars a day or X pool of money, but every year or two, we're going to send you an offer to increase your coverage with no medical requirements. And that way you can keep up with inflation needs as you go forward. But if you decline this offer 2 times in a row, we're going to remove this option as you go forward. So again, it pays to review your coverage because you may have some options out there you haven't even paid attention to that could help you out and take advantage of that. So that was a look at what a long-term care policy does from a traditional component standpoint. Let's get in more of this conversation about what is extended care, because extended care is no longer just care in a nursing home. It can be care in your home or in assisted living communities. There are so many assisted living communities popping up all over the state of Texas. Some of them are general assisted living communities. Some are centered around religious or fraternal organizations. Some are centered around professions. There's an educators community that is up in the Waco area. So there's different types of facilities all across the state and across the country. Most people like to be cared for at home. And we'll talk about what a good long-term care plan can do for you that way. When it comes to paying for extended care, just as there are many options to receive your care, there are many options to pay for your care. Most people, unfortunately, will pull from their personal savings or assets. If you're a big Dave Ramsey fan, I think he says if you've got $5 million or more, you're good to go, that you can pay for your own long-term care if you need it. Most of us don't have more than $5 million sitting around. So there's other options that we have out there. The large majority of care is usually provided from assistance from family and friends. And what that means is someone taking off of their job or stopping their career to provide for loved ones and the care in their home, or having mom move in with them, something like that. Some will move into a Medicaid program. I'll talk a little bit about that in the future and how that's very difficult, especially for state employees who have pensions. And then the other option is extended care coverage, because it gives you control. And I'll talk about what that control does for you as well as we go forward. Now, I told you about my father, and I showed you his picture there. Whenever he had his last stroke that required major surgery and a pretty lengthy time of stay in a hospital, we had to make the decision that he was no longer safe to stay at home. He was 78 years old and had, like I said, been pretty healthy well up into his 60s. And we had to make the decision to move out to a facility that we really liked out in Marble Falls. And I would go out and visit him, and I would notice that there were people in there who were younger than me. And I would ask the nurses and the staff there, I said, hey, what's the situation? And they would say, well, he had a traumatic brain injury, or had a fall, something like that, or was in an accident, or he had something at birth, but then his parents passed away and there was no one to take care of him. So they moved him into here. So even younger individuals, you never know when that need is going to be there. As we age, we all know that there are things we can't do for ourselves like we used to. And that's sometimes through arthritis, other reasons. But, waiting until a certain particular time or trigger is not always the safest, because you never know what's going to happen and when we're going to need it. Now, we kind of addressed some of the myths in our pop quiz, but there's this myth that healthcare, health insurance, whether it's Health Select, whether you're on a Health Advantage plan, Medicare, all those type of things, that they're going to cover my long-term care costs. There are particular provisions within some health plans, as well as the state plan and Medicare, that will pay for certain periods of time for certain things, but usually they will not pay for, and specifically they will not pay for chronic conditions or past a certain date. So we'll talk about that. Then there's this misconception that Medicare and Medicaid are the same thing, and they're definitely not the same thing. And we'll talk a little bit about, how Medicaid and how to qualify for that. And then as we've dispelled this myth about you're too young to buy. I work with individuals, retirees all the time, that look at this and say, I need my daughters to have coverage, because you can get it at a younger age, easier to qualify, less expensive price as well. And as we talked about the community where you can receive care, it never made sense to me to work all of your career for someone else to determine how you're going to live your final years. We were very appreciative that my father had a plan that allowed him to stay at home as long as possible, stay connected to familiar surroundings in an environment that my stepmother provided, in a community where he knew people, as long as he could remember who those people were. A good long-term care plan, however you have, allows you to stay connected to those things that matter the most. Community, home. If you then need to move into an assisted living facility and have progressive care until you can no longer get that care and need to go to a nursing home facility, you've got that path. You have control over how you're taken care of. So let's look at some national studies. Mutual of Omaha provides probably some of the best long-term care coverage in the country. They're one of the most stable providers. They've been around forever. If you used to watch the old Mutual of Omaha's Wild Kingdom, that's the same company that does that, that provides long-term care. They do a study, and the study should come out probably in a couple of months. So we've got the most recent study was of 2022 for 2021 that shows on average for national numbers about $27 an hour for a home health aide, which is about a 40+% increase in inflation over the past 10 years. But you see nationally, you run up to $4,800 a month for an assisted living facility, $8,200 a month on a national basis for semi-private room, and over $9,000 for a private room. For my father, his semi-private room was around $6,000 in Marble Falls. It was not the Taj Mahal. It was a great staff in a great location that my stepmother could go visit him frequently, but had really good rehabilitative facilities and activities to keep him engaged. So again, your mileage may vary. So what I did was I kind of looked at our major metropolitan areas, and I looked at Wichita Falls, a little bit more of a rural area in the part of the state, and took the last numbers. I want you to write down genworth.com, GENWRTH.com. Genworth does, at the bottom of their homepage, a cost of care calculator where you can plug in zip code, city, state, wherever you want to, and it will calculate the average cost of a home health aide, assisted living facility, semi-private room, or private room. And you can see across the board what the costs are. Austin being overwhelmingly the most expensive that's out there and is going up the fastest. Just the change from December 21 to last year was an increase of 25% in assisted living costs and nursing homes. The cost of land, the cost of compliance to federal regulations, staffing, those type of things are driving costs up dramatically. In Houston, it's kind of the opposite story. There's been a little bit of a decrease in cost. Dallas-Fort Worth is mixed. Wichita Falls, I haven't started tracking this as much, but you can see the disparity in costs across the major metropolitan areas and some more rural. And sometimes the more rural you get, the home health aid costs are higher because the mileage traveled cost is more than the cost of gas. So this kind of gives you an idea. As I mentioned, my father was $6,000 a month for his care, and what that could look like for you as well. Now, Mutual of Omaha provided us with some statistics that show us the average person that goes on claim is 78. And that was right on spot on with my father. Some younger, some older, but on average 78. And overwhelmingly, more women go on long-term care than men. This is simply because usually what happens is the male in the household, when they start to need care, the family will spend all of their money, all of their effort, keeping him home as long as possible. Then he passes away and the money has run out, and the wife in the family has worn herself out physically and then has to need some form of long-term care. The top 3 reasons for needing care: dementia, heart disease, and arthritis. So if you've got a history of any of those in your family, I'd highly encourage you to look at something, but just gives you an idea of what's out there and what the current trends are. So when it comes down to paying for long-term care, I showed you the numbers. I showed you the places that you can be cared for and how people pay for this. What usually we find is, and James and I find the biggest barrier is that first dollar. People have some long-term savings they've saved up, or maybe they've got a long-term care plan with a large elimination period to keep it less costly. But they start to look around and say, I've got to pull money from somewhere. You can't call ERS and say, hey, can you double up my pension payment? So do you go out and look at your Texas Saver account? Do you look at an IRA? And you pull those things. There could be tax consequences. There could be loss of future earnings on those. Or In the state of Texas, we've seen people have to sell family land, things like that. That can be a difficult challenge if you don't have some type of long-term care plan in. Medicaid is really a last resort option. And you talk to different Medicaid attorneys, excuse me, and they'll tell you you've got to go spin down your assets 5 years back. Medicaid will do a look back for that. And then if you do qualify, which is very difficult to qualify because most time state pensions keep people above the poverty level, the state's going to go back and seek reimbursement from your estate for the cost that you may have incurred that the state Medicaid had to pay for. So again, Medicaid is pretty difficult, and then paying that first dollar out of your pocket could be difficult. So one of the solutions could be a long-term care plan. And people think, well, I'll just wait for Medicare to pay for this. Medicare is a limited option. I want you to write down some numbers for me. I want you to write down the number 3, the number 20, and the number 100. Because Medicare will pay for long-term care needs or extended care needs only after you've had a 3-day hospital inpatient stay. And I'll talk about an inpatient stay in just a moment. Once you're discharged, it must be to a skilled nursing facility, meaning one that is trying to rehabilitate you to get back on your feet, feed yourself, dress yourself, care for yourself. Medicare will pay 100% for the first 20 days. So there's that number 20 that I asked you to write down. After that, you'll be responsible for a $200 coinsurance per day. After 100 days, Medicare, Health Select, anything, they stop paying altogether for any type of skilled nursing or long-term care, and you're 100% responsible at that point. Now, the tricky part comes in with what is inpatient versus observation status. Medicare and all of the healthcare select or health select plans behind that follow Medicare guidelines, they follow a billing cycle that qualifies each different procedure as either an inpatient procedure or an outpatient procedure. What doesn't change is the type of care you receive in the hospital. What changes is what benefits are triggered after you're discharged. So say a knee replacement surgery 10 years ago could have been classified as an inpatient stay. You stayed for 3 days, you received all those rehabilitative services. Medicare could, with the stroke of a pen, and they change thousands of procedures every year, they could change that same procedure as an outpatient procedure. It doesn't change the fact that you stayed 3 days in the hospital. It doesn't change the fact that you got your surgery, you got your recovery there in the hospital. What changes the fact is that there is no coverage for skilled nursing after the fact, and you're responsible for that all the way together. And then if you do go to a skilled nursing facility and they decide at some point you're not going to get better, you're no longer able to feed yourself, you will not be able to walk anymore, you're not going to get better, Medicare, Health Select, all of those, they stop paying altogether, regardless of the 100 days, regardless of the 20 days, that type of thing. If you're not going to get better and have a chronic condition, Medicare, Health Select, they're not designed to pay for that. So really, your solution is a long-term care plan that allows you to supplement your expenses, whether it pays for everything or whether it's in conjunction, a hybrid with your personal assets, but it allows you to protect the assets that you've worked hard for. In the case of my father, it allowed my stepmother to stay in the house that they spent 30 years together in. It allowed her to maintain the standard of living that she was accustomed to without having to pull down out of those retirement savings that they worked so hard for. It ensures that her lifestyle continues after my father passed away. Most importantly, it allows you to have control over where you're taken care of. It allows you to stay connected to those things that matter most. And for my father early on, and for most people, it means staying at home. It meant someone that could come in and do those light housekeeping details or stay up with him at night so he wasn't a fall risk, helping out with those details like bathing, dressing, but keeping him in a familiar site in an area he's accustomed to. A good long-term care plan can provide for equipment like adjustable beds, chair lifts, stair lifts, things like that to keep you at home. Home modifications such as widening doors, providing ramps, things of that nature. If it can keep you at home where you want to, isn't that what we want to be? We don't want to have to go to, and it was a difficult decision for my stepmother, my brother, and I to go to a place that to take my father to, but my stepmother could no longer care for him in the manner he needed to be. A good long-term care plan gives you control and peace of mind over that. Some plans give you the ability to get cash. The minute you're diagnosed with a condition that's not going to improve or period of time, you can get just a lump sum cash to use however you want to. Others, like my father's plan, was a reimbursement plan that once the billing cycle started from the nursing care facility, they billed directly to the long-term care plan. They cut the check. There was nothing my stepmother had to do at all. Just reimburse those expenses as he went along. Now, I encourage you, as we get older, we don't know what's going to happen to us health-wise, but within the long-term care industry, it gets more difficult to qualify for a long-term care plan as we age. So once you get to age 75, it's about a 50-50 chance. What happens in a long-term care application process, they're going to ask you health questions. They're going to order medical records. Sometimes those medical records need to be corrected. Sometimes there will be some family history that's requested, things like that. So there is a process to go through here. It gets to be a little difficult the older we get. And then the longer we wait, sometimes the costs go up as well. So most long-term care plans are age-based rated as well as health condition related. So the longer you wait to purchase, it can go up and cost you a little bit more. But there are other options. This is the nice thing about being with TPEA, having an association with AMBA. You have options that can cover the daily benefit amount. You can get weekly amounts. I got a plan for my mother that covers $1,000 a week if she needs to have someone come into the house, even if it's someone from her church to provide care for her, just stay with her if she needed it. You can have coverage that just covers that elimination period. So if you already have a plan that you can say, I don't want to spend $9,000 a month out of my pocket for the first 3 months until my plan kicks in, I want to have something that covers that. Covers a length of coverage, shorter time period, location of coverage, non-skilled care. Again, as I mentioned, there are a lot of other options out there. So I highly encourage you, if you've got questions, I'll show you that QR code in a moment, put them in Q&A. We're going to talk about the other side of the coin. We're going to go into those options more in depth in Long-Term Care 201, talk about some of your state benefits, how that works, talk about how you may have some plans already and what you can do with them if they're going up, how to make the changes, what you need, what your benefits that you have coverage there as well. So we'll do that on the 31st. We're going to talk about dental and vision plans through TPEA on the 28th of April, talk about how they compare to the state plans. The ERS plan is a great plan. Some people choose to get coverage on top of that or for children that have aged out, things like that. We'll talk about Medicare in May, talk about how to protect your nest egg on the 23rd coming up in June. So there's lots of things going on, but one thing I want to point out, you have a tremendous, tremendous free benefit through TPEA. It is the Passport program. This is a free discount program. TPEA has worked hard to add a bunch of new discounts out there. If you're living in the Austin area, as many of our TPEA members and friends are, there are literally hundreds of new merchants added all the time. Everything from retail to dining to services that are out there. Some of the big ones out there right now are related to taxes, pet care, lots of vacation spots. If you're thinking about your spring break or summer travel, it's time to go out there and get that. You can find out all about this at myambadiscounts.com. We can help get you signed up. So take advantage of this. It is a great opportunity for you to make your, just in using it one time is going to make your TPEA dues basically free. Please, please, please tell your coworkers and your fellow retirees about these webinar series and tell them about TPEA. This is a great way to introduce them to your association, find out the legislative issues, what's going on, how to get involved. We need more TPEA members. When Ann and Ray and the team are testifying up on Capitol, to be able to say we've got 10, 15, 20,000 people behind us, it helps carry the weight a little bit stronger. So I'm going to wrap it up here. If you've got questions, please feel free to put that into Q&A or chat if you want to. If you want to find out more information, simply grab your smartphone, cover Open up your camera feature, hover over that QR code, a little form will pop up. You can select a few things. It'll come back to us and we'll have someone contact you right away. If you're on your smartphone or you're on a tablet and you can't use your camera device, simply email me at john.green@amba.info, john.green@amba.info, and I'll get back to you as soon as possible out there. So, and before we wrap this up, anything you want to share with the group before we close today?
No, we just appreciate your service and your time and your service, whether you are a current employee or where you are, if you are a retired state employee. You do meaningful work, and we know that you do meaningful work, and we pass that on to the legislative members every day. And so we do appreciate you. And if you have any questions at all, you feel free to reach out to us and we'll try to answer them the best we can.
Okay. And we did have an interesting question. I've never had this before, so I'm going to leave it back to you. What's the difference between TPEA and RSEA of Texas?
Well, there's a couple of differences. TPEA is Texas Public Employees Association, and we're 76 years old. We were created by active state employees and retirees at the time in the 1940s to advocate for benefits and salaries for state employees and retirees. So throughout our history, one of the major differences is that we cover state employees from their first day of work until they are no longer with us, not necessarily with TPEA, but have deceased. So we have a different perspective on things. We try to provide continuity from your first day of work until your last day on this earth. That's one of the major differences, is the groups that are covered. In terms of advocacy, we have a professional staff. Then we also have contract people who help advocate on a daily basis. So we're there at the Capitol on a daily basis. RSEA primarily just advocates with volunteers, and they are there primarily when the ERS appropriation is up, whether it's in Senate Finance or House Appropriations. And they'll also attend some other hearings as well, but they're very specific hearings in terms of the advocacy. And ours is broader and constant. So for instance, we bring you these webinars. Our communications is more extensive. We bring you webinars and weekly newsletters or bi-weekly newsletters, depending on what time of year it is. We also hold a number of events, whether they are informational events or social events for our employees and retirees. So we just have a broader perspective and a broader outreach and communications. So there's really three who are covered: the advocacy, presence, and I would argue the effectiveness. And the third is the communications.
All right. Thank you, Ann. Appreciate that. There's a couple other questions that have popped in there. I'll let you take a look at those before we come back. We had a great question from Patrick, because there were about 30% of you that said, hey, I've got a plan. And there may be some of you that had the long-term care plan that the state offered several years ago. He asked, will the plan that the state used to offer, is it still being honored? Absolutely. The one thing about the Texas Department of Insurance that I've worked with for 30 plus years, they make sure that there's financial stability with those companies to make sure that they continue to offer the benefits for current policyholders, even if they don't offer new coverage. With that being said, there were some provisions in that policy that I kind of covered on that hamburger illustration. They're pretty standard out there. Most of the plans that I've seen are pool of money provisions that give you a certain amount of dollars that you can use. And then they will have some inflation protection that is offered to you every couple of years. And so where we see oftentimes with people who have that plan is they got that letter, they didn't understand what it meant, and they set it aside. Then next year they got that letter, didn't know what it meant, and set it aside. And now they're not quite as sure, can they get more coverage? Can I do what happens? And then we've seen some of these plans start to raise their rates in later years. I highly encourage you, use that QR code. Let someone from AMBA review your plan. They're very well versed in the type of plans that are out there, can kind of show you what you have coverage and where you may not have coverage. I never, ever, and one of the first days I met Ann, she asked me to review her plan. I never encourage someone to cancel a plan. I've seen the power of what it did for my father and my family. I never want someone to cancel a plan. Some people unfortunately have to because it gets too financially burdensome for them. But even then, you have benefits that are continue on even if you have to cancel a plan. Please, please, please hear me well. Do not cancel a plan. Have someone review it so that you understand what is out there and what's available to you. So hopefully that answers your situation there. There was another question about, maybe somebody joined us a little late, on cost of living increases for annuities, things like that. Ray, you want to kind of address that to the group?
Yeah, John, I just saw that question. When we were talking earlier about what the ERS will do, ERS has put out a public statement now, and we showed it earlier, that says that effective December 2024, based on the monies, the additional monies that the legislature is putting into the budget bills, the appropriations they're making, based on that, they expect to be actuarially sound, to meet the threshold they need to meet in order to be able to give a COLA. But they can only give a COLA by law to this one certain group right now. And that group is those who, effective January of 2025, have been retired at that time 20 or more years. And then those folks will be receiving, ERS expects a COLA from ERS. We are meanwhile advocating, testifying, visiting as best we can all across the Capitol, trying to make sure that all the other retirees also receive some sort of benefit increase. And that's kind of the latest on that.
Well, and just to be clear, there's two ways for retirees to get a cost of living increase or a 13th check. One is out of the ERS fund, and that is what ERS put out, the statement that indicated when they can be able to do a statutory required or authorized COLA through the ERS fund. The other option is to get money directly appropriated for that purpose. And there are two bills out there that talk about giving additional cost of living increases. They don't have money associated with it, but that's one of the things that we work to do, is try to get money associated with those bills independent of whatever the ERS fund can afford.
Great. Thank you all very much. Again, I hope you can see the value of these webinars, not only in the content, but the latest updates out there. And we've got some folks, our friends with us from ERS. Again, when you go out to the ERS website, I think there's a link, Catherine, if I'm correct, where you can contact John Hancock and they can walk you through those plans as well. So again, ERS does a phenomenal job at keeping resources available to you. So go out to ers.texas.gov and take a look at that. When you look at optional benefits, that box I showed you, there's a link that will take you to John Hancock. That phone number is 800. So grab a pen here if you're a John Hancock policy holder, 800-482-0022. They can help you out with that. Again, we would be glad to review that policy and show you what's available, show you what your coverages and your options are as well. But again, John Hancock is a very stable company and should not have an issue at all with still continuing to honor that policy. So Catherine, thank you for that detail. Thank you all for joining us today. I'll leave the QR codes up just a little bit. And if you've got any questions, feel free to drop those in there. But again, thank you for joining us. Ann and Ray and Charlotte, thank you for joining us today and for continuing to push the important measures for active and retirees in the state employee group. So we appreciate you and thank you for all you do. And again, if you want to become a TPEA member, you can use this QR code just right on their membership. We'll get you in contact with someone who can take care of your membership as well. Have a tremendous rest of your day, tremendous weekend, and we'll talk to you soon. Take care.
Thank you, John. Thank you. Thank you all.